Hi, this is Total Health Center, and today we are introducing our latest technique and technology to THC. This is the iron neck. Because the contraption you see on top of the head of Caleb is called the iron neck. This is a beanie head. Each patient gets one to put over their head for two reasons. We put this on the head of a patient, then put the contraption on the head. This is for health reasons. Every patient gets his own. Plus there is no direct contact of the product to the skin, which also eliminates the friction on the surface of your head. We're going to do a couple of exercises for patients with neck, shoulder, mid-spine issues. I'm doing this in sitting because it's a good way to start. The contraption I have there is a professional unit, which is a little more intense than the simple one we have. So for advanced rehab, this would be the unit we'll be using. If a patient has got a very weak neck, is unable to use this, then we use the one which is one grade down. So the motion we're going to do is a diagonal motion. This will actually is hooked on the wall, but for demonstration purposes I'm holding on to it. He's going to do a left flexion. He's doing a flexion, left side bending, and goes into right rotation and extension. Repetitive motion. Depending on how strong it is, I can either increase the resistance by pulling a little more, or I can make it simpler by reducing the resistance, and he can do more repetitions of that. So that's one movement he can do with this. We can flip him, Caleb, you can stop, sorry. We go and do the reverse motion to work on the eccentric muscle group. Very easy. And then reposition him. If you notice the head doesn't move, it's the mechanism which are moving, which is still very comfortable to the patient. And I stand at this angle, and you're going to look up for me, Caleb, this way. Look at my hand. So it's going to start with right rotation with extension, a three-dimensional motion, and you're going to go into your left armpit. So right rotation, left side bending, right rotation, left side bending into flexion and left side bending. Five to 10 reps of this is enough to make your muscles tone out. We can do retraction and protraction as well. The iron neck. New product in the market, first ones in state of Michigan to use this. Got released just about very recently. Don't know the exact launch date of this product. Sit up straight for me. I'm a little off. If you notice during the process, he has gone a little off, and we need to readjust this one more time. Either the hat is off or the position is that looks better. If he doesn't feel comfortable, let us know. How's that? Good. Thank you. All right. Retraction. You can see Caleb is having a little hard time with that simply because he's never done this before. He hasn't used it. He's using a lot of his accessory muscles, not a lot, quite a bit. And I think over time he can be trained to use the right muscles given the correct cues and direction. How does that feel right now? That's about 8-9 reps, and you notice it is tiring now. He's really giving all he's got, and we will stop there with about 10 reps on that one. One more. We can do in this position, the multiple ones. I'm only doing a demonstration of 4. See how easy it was to loosen it up, hook it up, and then I would stand behind him, have this hooked, and then do the forward chin down. And that's 4 exercises which can be done in 4 minutes or so.